This video was produced for the purpose of raising awareness and exploring the issue of lateral violence in nursing. The intended audience for this video is hospital nurses, experienced staff nurses, charge nurses, preceptors, new nursing residents, and educators. And this video will be presented in the framework of narrative pedagogy. What is lateral violence? Lateral violence has many terms: horizontal hostility, vertical violence, workplace incivility, bullying, disruptive behavior, peer incivility, and nurse aggression. And it happens at all levels in all different nurses. And these stories will help us to reflect on and think about lateral violence in nursing and what it does to our professions.
Years ago, as a nursing student, I was so eager and ready to start my rotation at a hospital. So I went in, and the first thing I heard right off the bat was a nurse saying, "Not nursing students again. I hate nursing students." So, you know, I kind of just wanted to crawl back in a little corner and not do anything the rest of the day because I was scared. You know, it made me frightened that I would make a mistake, you know, in front of the nurse and get chewed out. So I just kind of stayed by myself the rest of the day because she didn't pay me any attention. So to this day, as a nurse, a seasoned nurse, you know, I always think about that in the back of my mind. So when we have students, you know, I welcome them and I praise them and I always make sure that they have, you know, a nurse that's ready to, you know, take them on and teach them and learn them.
As a seasoned nurse and functioning charge nurse, sometimes the day gets really busy and hectic. On this particular day, I had a nurse that needed assistance with an IV. I told her that I would come in and do it in a few minutes as soon as I got done with huddle. In the meantime, another nurse comes by and says, you know, "What is it that you need to do?" And I said, "I need to go start an IV." She said, "That's not your job. That's not your responsibility." And she went and she did it. Minutes later, she came back and I asked her if she had gotten the IV. And she said, "Yes, I got the IV. It was an easy IV, one stick." The people that had tried, the nurses who had tried to put that IV in a few minutes ago overheard the conversation. The new nurse, the new grad nurse, looked at me and she said, "In clinicals, I was really good at that. I'm sorry I didn't get that one." So she felt really bad that she didn't get it.
Lateral violence that I have experienced as a seasoned nurse as well, working with the nurses on a very, very busy unit, busy day, trying to get discharges going and getting ready for new admissions. I looked at the charts to see who needed anything done. I approached the nurse of one of the patients that was actually ready to go home, and I knew she needed to have a PICC line DC, needed to have medications administered, and I was trying to help to get the patient moving, and the patient was ready to leave as well. Ride was on her way, and she was more than ready to get out of the hospital. I approached the nurse in another patient room and said, you know, patient in room so-and-so is ready to go. What can I do to help? The nurse's response was like, "I'm busy right now. I don't have time." I let her go for a few minutes. I went around at a couple of patients, came back to see if things had gotten better for her. She was again in a patient room, and I came back and said, you know, looking at patient so-and-so, she's ready to go. Do you need me to do anything? The nurse turned around and looked at me and said, "Get off my back. I'm busy. I don't have time for this right now." This was all said in front of a patient. I did not address it at the moment and didn't feel I could say anything else in front of the patient. I just pretty much kind of turned around, put my tail between my legs, and walked out and turned around and went the other way. So I just felt not as hounding on the person, the nurse needing to get work done. I wanted to be of help and assistance for her, and I did not feel she perceived it that way, and that beat me down so that I don't know whether to ask her for, you know, if she needs assistance or just leave her alone. And that doesn't help our patients.
I had gone in early one shift to talk to my manager. I was excited about that I was going to accept a transfer to another unit. At the same time, I was concerned about the reaction that I would receive from my manager due to previous incidents that I've had with her. And when I told her that I was going to be transferring to another unit, the response that I received from her was not what I had quite expected. The words that came out of her mouth and the expletives that flowed from her mouth over the next 2 or 3 minutes, this tirade that she had, was quite shocking to me. Honestly, I can tell you that I've never been taught to that way in my entire life. And it was hurtful, I was shocked and really unsure what to do. I felt guilty about even making a transfer. And that was just one incident. And over the course of the next year, after I moved on to this other unit, seeing this manager in the hallway or on the elevator, it was like I had never even existed. She didn't talk to me. She didn't acknowledge my presence.
Okay, one day when I was observing nurses do shift report at the bedside to see how well the nurses were doing, I observed one nurse really drilling down the off-going nurse and asking her why she hadn't finished everything, why everything wasn't done, and was almost attacking her in front of the patient, and the patient in the room was kind of looking at the nurse. And I had to think of how well that patient's now going to perceive the nursing staff, their communication style. And not only hurt the nurse that was leaving, that tried to get everything done, but also the nurse that was coming off in the next 12 hours. I think it decreased her credibility with the patient.
Okay, I guess I have some questions for you all as a group to talk about different strategies. Now that we've kind of discussed and had dialogue about what lateral violence does to our culture of nursing and how we want, as a group, we want to build healthy work environments, what are the strategies that we can use to help improve and to address lateral violence in our units and with our staff?
I think as far as, new grads, because I experienced that as a new student, I think you just need to educate your staff, that you were once a student yourself. So put yourself in those shoes and think about how you would feel if you were treated that way.
For myself, I think promoting an environment where communication is open and making sure that everybody understands that every patient is everybody's job, and not to make anybody feel bad because they needed help with something. My fear is that the nurse that needed help won't ever ask for help again, or at least won't ask certain people for help. And I just believe that we're all in there together and we need to help each other out.
For myself, I think promoting teamwork and understanding what teamwork looks like when things are not going well, the unit is busy, things are getting, patients are coming and going fast. We need to remember that we are there to help each other, and I think approaching the person afterwards outside of the patient room and having a discussion with them or a conversation with them, that we're there to help and not to hound them or pressure them into getting things done quicker. We're just part of the team that is going to be there for the patient and for the nurse and for each other.
I think this is a very difficult but very real topic. For me, a simple solution to it would be to treat each other with respect and extend the professional courtesy. I don't have to like you, we don't have to be friends at work or outside of work, but I think there should still be a professional courtesy that's extended because we are professionals and we're here for one goal, and that's for patient care, and we should be able to do that together for 12 hours.
Thank you for your participation in this video. And why does civility matter? It matters most for our patients. I think it all goes back to the patient. If we have a colleague that's afraid to report an error because they're afraid of the criticism they're going to get, the patients are going to suffer and we won't be able to prevent future errors. And what if information is withheld that we need to know about the patient because of fear or because of the silent treatment of one nurse against another? These are all very important considerations in the care of our patients. We want to do what's right, and we are nurses, we're professionals, and we want this to no longer become a barrier for us to provide patient-centered care.
Do you have any bullying behaviors?
Have you been a target of bullying?
Have you been a bystander? What did you do, and how did that make you feel?
Is incivility a normal behavior in our society?
Are you a bully?
How do we make it stop?